Yeah, I think you can take this from a scientific aspect and a practical aspect. So obviously, I think in the scientific aspect, things like bioprinting, I guess it is technology specific, but just talking about bioprinting, because I chaired a session on this just yesterday, I think we're still struggling to have a good range of material, for example, material candidates to pick from to be able to, support the customized deposition of cells, but at the same time still have good mechanical properties. And that is a real problem in the musculoskeletal field because they're supposed to be hard tissues. And if you do stuff like bioprinting, then you're pretty much limited to hydrogels. And the hydrogels are their stiffness is in the kilopascal range. You're not going to really use that in a load-bearing defect. So that there's scientific problems like this. And there's also resolution problems. I would say that I guess our current, especially in the additive manufacturing sphere, our current resolution is probably not as great as what we would hope that they are. I mean, there are nanoscale printing methods and equipment being developed, but they're still very much not really accessible by the majority of researchers around the world, I would say, except for, big biofabrication facilities that are specifically established for that purpose, which requires a lot of funding. And I guess it's also probably in the cells aspects, like what kind of cells are you going to use to be able to produce these constructs? Because if you use primary cells that are derived from patients, then they're not going to be able to, they'll have donor variations and they can't be expanded forever. Whereas if you use things like iPSCs, like the induced pluripotent stem cells, they're like a really exciting development, but I don't think we're really there yet in terms of really using them as any kind of standardized clinical therapy just at this point in time, because I don't think a lot of the processes associated with reprogramming and differentiation has been optimized. So I think those are maybe the main challenges from a scientific perspective. From a practical perspective, I think tissue engineered products in general is still relatively very new. And I think regulatory authorities such as the FDA are struggling to come up with an adequate framework to really catch up with the field. And especially when they're only still at the point of autologous cell therapies and whatnot, but then now we're sort of progressing into all these combinatorial kind of therapies where it's more than just one aspect. So do you classify it as a medical device if it has some kind of biomaterials aspect, but then it also has cells, or maybe it has growth factors or genetically edited cells or the secretory products of cells? And that is a real problem, I guess, in the field that I'm currently working in, which is for the extracellular vesicles. Like they're sort of in between, like you can treat them as a drug, but then you can also treat them as a biological product. So what kind of regulatory framework do you even use to be able to translate this and actually apply in patients? I think that's a big problem. And the other thing is scaling up. I think if we're talking about cell-based products or even for biomanufacturing, how do you keep so from say if we're developing new materials and then it takes 20 steps and you just can't really maintain the large scale consistency of these products to make sure that you're actually that every product is the same and also the properties are customizable. And in terms of cells, we were going to have donor variations. For cell therapies, we struggle to get sufficient numbers of cells to be able to that is sufficient for a effective clinical therapy. And also, again, for the extracellular vesicles, then you need an even bigger pool of cells to generate a sizable amount of EVs to put somewhere for them to have a sustained therapeutic effect for a long time. And I think, establishing these large-scale manufacturing facilities, particularly under GMP and other, sort of industry standard, therapeutic standard products, the production of these would be a challenge.